The thoracic space has really moved very, very fast. It's now an era where it's possible to reconstruct the whole of the aorta, including the ascending aorta, from the aortic valve. We shall be hearing Rod White speaking of that with the Ascend device, replacing part of the ascending aorta by an endovascular technique. There will also be presentations of reconstructions of the arch of the aorta with various devices using branches to the main vessels of the arch, and devices into the left subclavian artery made currently by two excellent companies and a third underway. So this leads to a lot more instrumentation of the aortic arch. We have a spin-off interest at Charing Cross 2017 of concern of embolization to the brain from these arch procedures, and we shall particularly pay attention to that towards the end of the symposium in the acute stroke consensus update. As all of the audience know who are sophisticated and practicing aortic surgery, they will know that there are four pathologies in the chest: transection, dissection, atherosclerotic aneurysm, and also ulceration. The Charing Cross Symposium 2017 will have a major unraveling of the current practice of dissecting aneurysm. There are many types: acute, subacute and chronic, type A and type B. One of the things we shall try to do at Charing Cross is challenge all of the definitions and see if those definitions are still valid. So experts will discuss that. And then they will particularly discuss whether and what the evidence is for intervention in the fairly quiescent type B, chronic type B dissection, where there is still a debate going on whether an intervention will give a better long-term prognosis. Some would wish to block the false lumen by various methods. Others will want to reconstruct the whole of the aorta. But the big question remains whether we should be doing that at all, and whether it is a matter of stabilizing the dissecting aneurysm at an earlier stage. So all bets are off. At Charing Cross 2017, the world best experts, as I know it, have designed the most excellent session to try to unravel and understand dissecting aneurysm. There'll be another exciting part of the thoracic section, that of radiation awareness. As imaging gets better, so is there an increasing awareness that radiation can cause damage to the patient and to the operator. And this awareness is becoming more and more focused and of greater and greater interest to many of the key opinion leaders in the world. There have been many suggestions of how to reduce this radiation burden. We look forward to hearing many of those, including how to cover and prevent reflection of radiation from the patient, how to screen the doctors, which of the assistants and the operators get the most radiation, how to prevent it, and so on. There's also a radiation burden from the investigation of patients and the serial investigation of patients. We raised the question of whether ultrasound should be used in preference to CT scan, for example. All of that you'll hear at Charing Cross 2017.